It's Dr. Silvia Stratulat, who's the head of HIV and viral hepatitis surveillance department in the National Public Health Agency of Moldova. Silvia is a longtime colleague, and we greatly welcome her to this webinar. Silvia.
Hi, afternoon. Good afternoon to all. First of all, I would like to thank to the Coalition for Global Hepatitis Elimination for invitation, the opportunity to learn how to apply practical strategies and expand hepatitis B screening, but also to share our experience of Republic of Moldova in this return. Next, please. Slide. Viral hepatitis presents one of the challenges in the Republic of Moldova due to its increased morbidity and mortality. Of course, according with our statistical data, of total cases of chronic hepatitis, about 66.7% are of viral etiology. There are officially registered about 31,000 cases of chronic hepatitis B and around 17,000 cases chronic hepatitis C. At the same time, I would like to say that there are estimated with hepatitis B about 43,000 persons, and with hepatitis C about 55,000 patients. Of course, respectively, only 70.2% of patients know their status with hepatitis B, and respectively, only 30.2% of patients with hepatitis C know their status. Please, next, please. Next. Dynamics of viral hepatitis B and C morbidity in Moldova indicates a decrease of acute hepatitis incidence and increase of chronic forms. This is due to the prevention measures implemented, including vaccination against hepatitis B, which was been included in the National Immunization Program since 1995, and implementation of infection control measures, but also increasing access to testing for detecting case of chronic hepatitis. Screening with rapid test in the last 5 years has contributed to the detection of chronic forms. Thus, the incidence per 100,000 population in 2024 for acute hepatitis in Moldova is 0.4, and for acute hepatitis C is 0.9. Comparability with chronic hepatitis B, that is 23.3, and chronic hepatitis C, that is 45. Next, please. I want to mention that hepatitis has a high seroprevalence in populations at high risk. Seroprevalence studies conducted in the country among people in increase of risk have indicated a high seroprevalence for both hepatitis B and hepatitis C. Viral hepatitis B among injection drug users, sex workers, and MSM has a seroprevalence of about 3%, while hepatitis C seroprevalence among injection drug users is very high, 49.3%. Among sex workers is 8.6%, and among MSM is 4.7%. Next, please. Moldova has been implemented a lot of efforts to increase the detection of people with hepatitis, and in aim to detect chronic hepatitis. So, starting with 2020, universal access to screening with rapid tests is ensured for all people with a complete geographical coverage that is available in primary healthcare points. In harm reduction settings for key populations is provided screening tests of hepatitis B and C with rapid tests that are provided by NGOs. Also, screening testing for hepatitis with rapid test is accessible in penitentiary system that are approached from state budget resources. And GenExpert methods are applied to confirm diagnostic and, of course, monitor DA treatment. Next, please. Special attention is paid for people with the increased risk of infection, especially for injection drug users, for MSM, for sex workers within the risk reduction programs. For these populations is implemented an integrated approach in our country of prevention service for HIV, STI, and hepatitis. Services are provided according to the standard of organization or operation of HIV prevention service in the environment of key population, including for young people from these groups. This standard is approved by Ministry of Health, and the prevention service package for this population includes prophylaxis, testing, and treatment for viral hepatitis B and C. Next, please. So hepatitis testing, being a component of prevention service package, is financed from state budget, and it is reported and monitored like other components of the prevention service package, like condoms distribution, syringes, HIV counseling, referrals, and tuberculosis screening. Please, next. Hepatitis testing for people at increase of risk is provided through several methods, including in points of syringe and condom distribution. Testing is also provided with the field trips to places frequented by people at high risk to infection, and in mobile units at a distant place, but testing is also promoted by online networks. Thanks. Next. Several non-governmental organizations are involved in providing testing for hepatitis. Also, a rapid test is provided for drug injection users by 10 NGOs in about 40 localities in civil sectors, but is also accessible in penitentiary institution in 18 institutions. For sex workers, also 10 organizations, non-governmental organizations provide testing for hepatitis with coverage about 30 localities, and for men, sex with men, the hepatitis testing is covering in 17 localities by 6 NGOs. Next, please. Thus, in NGOs in 2024, with rapid diagnostic test, were tested around 14,000 people for HBs antigen, of which about 2.7% were with positive result, and around 17,000 for anti-hepatitis C, of which around 7.8% were with positive result. Next, please. As I mentioned previously, testing for hepatitis is accessible as well in healthcare settings. And in 2024, around 103,000 people were tested for HBs antigen, with that, around 3,500 were with positive result, and around 94,000 were tested as anti-HCV test. Next, please. For the purpose of testing, of course, is to identify positive individuals and confirm the diagnosis, and of course includes them in DA treatment. Respectively, an important aspect in providing hepatitis tests is given for referrals and accompaniment to organization or institution that provide service for populations with increased risk. Thus, persons with positive result are referred to healthcare settings for confirmation of diagnosis and inclusion in the DA treatment. Those with the negative results are referred to vaccination and vaccination offices or other services need, including STI diagnosis, opioid treatment, pharmacological treatment of opioid addiction, etc. Next, please. Referring hepatitis testing, we could note some achievements in Republic of Moldova, one of which is the regulatory framework regarding the provision of testing for HIV, hepatitis, and STI. That is approved by Ministry of Health, and this standard is applied in practice. The other one I can mention an integrated approach to HIV, STI, hepatitis testing that ensure testing for all three infections and providing testing in the field of affected communities by NGOs that ensuring targeted testing for people at high risk of infection. I also would like to mention that the funding for testing is provided from state budget. The country assumes this cost, and of course, assuring all basic intervention testing, antiviral treatment, and vaccination against viral hepatitis. It is very important to point that testing is accessed in penitentiary system and with coverage and access national worldwide. Next, please. At the same time, I would like to mention some barriers and challenges in our country. One of them is lack of intervention carried out at national level to increase awareness and inform the population and group at risk regarding the benefits of testing and treatment for hepatitis. This is determined by insufficient funding of interventions to raise awareness of the populations, including intervention for groups at increased risk and the general population. And respectively, in the country, there are no massive screening testing campaigns that at the national levels, including in the rural areas, to and remove locators. Next, please. I would like to say thank you for attention, but I think with the joint and persistent efforts in our countries, by ensuring testing and DA treatment, we will achieve elimination of virus in our countries. Thank you, and good luck for you. Thank you.
Thank you so much for that in-depth description of the program, as well as the achievements and challenges along the way there, Silvia. Really greatly appreciate it.